Let's discuss about an autoimmune disease which is called as Crohn's disease. This autoimmune disease, Crohn's disease, is a part of inflammatory bowel disease. We all know that inflammatory bowel disease includes Crohn's disease as well as ulcerative colitis. And Crohn's disease is more common, has got more common instance than that of ulcerative colitis. This condition is more common in case of females than that of males. This is because oral contraceptive usage has got higher instance of Crohn's disease. Hence, in females, this condition is more common than that of males. And smoking is found to be the causative factor, and there is no association of the appendicectomy in case of Crohn's disease. Crohn's disease is more common than the ulcerative colitis. This condition is more commonly seen in case of females than that of males due to increased OCP usage in females. This condition is more common in Jewish group rather than non-Jewish group, and smoking is the causative factor in case of Crohn's disease. Whereas in ulcerative colitis, smoking is a protective factor. In this condition, Crohn's disease, there is no association with appendicectomy. And OCP, oral contraceptive pills usage in pregnancy, increases the risk of Crohn's disease. Crohn's disease has familial incidence, is stronger in case of Crohn's disease. Antibiotic use in the first year of life increases the risk of developing childhood inflammatory bowel disease by 3 times. It is a granulomatous disease. And let's see the antibodies seen in case of Crohn's disease. Anti-outer membrane protein citrullinated antibody is more common among healthy family members of Crohn's disease, and also other autoantibodies seen are the anti-Saccharomyces cerevisiae antibody, anti-pancreatic antibody, anti-flagellin antibody, and I already said anti-OMPC outer membrane protein citrullinated antibody are seen in case of Crohn's disease. And the genetic factors which are related to Crohn's disease are NOD2 or CARD15, autophagy related genes, and also interleukins, that is IL-23. Let's see the clinical features seen in case of Crohn's disease. Fever, weight loss, lymphadenopathy, inflammatory mass that is palpable, string sign is positive due to fibrosed bowel, and the complications seen in case of Crohn's disease are fissure, fistula, strictures are seen. And let's see the investigations which help in the diagnosis of Crohn's disease. And on endoscopy, we find aphthous ulcer and cobblestone appearance is seen in case of patients with Crohn's disease. And also CT scan has got higher value in diagnosis than that of endoscopy. And let's see the extraintestinal features seen in case of Crohn's disease. Ankylosing spondylitis, episcleritis, uveitis, erythema nodosum, pyoderma gangrenosum, and non-Hodgkin's lymphoma are the extraintestinal manifestations seen in patients of Crohn's disease. And let's look into the treatment plan that is offered to the patients of Crohn's disease. NSAIDs found to be useful in these patients. Smoking has to be avoided as this condition occurs because of smoking. Smoking has to be avoided. And the steroids like budesonide are used in case of mild disease. In case of moderate disease, oral steroids with methotrexate with or without anti-TNF alpha drugs. Methotrexate plus azathioprine or 6-mercaptopurine are used. In case of severe conditions, IV steroids along with anti-TNF alpha drugs. If fistula develops in these patients, then surgery has to be done. And this is in brief about the condition, and thank you for watching.